Hey, welcome back to your checkup. We're a patient-facing medical podcast where we bring health topics from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Doleski, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we're so excited that you can be here with us today. Thanks for coming back.
We took back a break from our vacation.
We took a little vacation and observed the holiday, but we are back. And today, we want you to imagine.
Oh boy, here we go.
That you had a baby a month or 2 months ago.
Immersive experience.
And you're coming right back into the office. That's right. We're having another pediatric episode, much like our first couple episodes.
Mm-hmm. All right. You took your little fetus to their first appointment when they're a couple days old. And then now you have a 1 month old visit. And then they'll see the pediatrician at 2 months, 4 months, 6, 9, and then 12.
So that's the first year. In that first month visit, they cover a lot of the things that they do in the second month as well. And so we'll spend most of the episode reviewing information from healthychildren.org and the CDC to discuss the second month. But we want to talk about the first month briefly. In the first month, the only thing that's different from the second month is that some pediatricians will offer the hepatitis B vaccine. Other pediatricians will clump that in at the 2 month visit. Others will also do a 6-week visit so that you can get everything at once. And so just keep an eye out and make sure you have clear communication with your pediatrician about the proper schedule for getting your vaccines for your baby.
Gorgeous.
Great. So with that, now you're walking in with your baby to the 2 month visit. What are they going to say?
Well, first, we're probably going to start off with asking if there are any concerns that you have off the bat that need to be addressed right then and there, and then talk about them if you have to. You're definitely going to be asked about feeding and pooping, our two favorite things.
Oh, yeah.
Because that's, again, your baby's only job.
Around this time of life, say 2 months, 2 months old, how much of breast milk or formula should a baby be eating?
A 2 month old. Okay, so this is like very baby dependent.
Okay.
And also we're going to assume that your baby was born at full term.
Yes.
For all intents and purposes. Mm-hmm. In this episode, the 2 month old will eat about 4 to 5-ish ounces.
Okay.
Every couple hours. But then like some do more, some do less. The first couple weeks, it's like, or maybe, I guess a week. It's like an ounce or two. First month is 3 to 4-ish ounces. And then it gets more to be about 4 to 5-ish ounces every like 3 to 4 hours. But again, that's dependent upon your baby. Maybe your baby eats less more frequently, eats bigger amounts, goes longer
periods of time.
Yeah. Like especially overnight when they start sleeping more, and like that's all fine and good. So
at some point you can break free of that, like every 3 to 4 hours.
Yeah, like generally that's when your baby will most likely start to show their hunger cues that you'll start to learn about your baby, and then just kind of take it from there. And then a good indicator, I guess, really would be their diapers.
Oh, yep.
Are they peeing? Are they making wet diapers? Are they pooping? And then also, like, are they gaining weight? Assuming you have a girl, will get weighed at the doctor's office. They'll trend that, do all of the percentiles and things.
And that's a huge reason to go back to the doctor, so they have that information and they are actually able to literally put the baby on a scale. It's a huge piece of information that lets everyone know, is my baby eating enough? Which will be a really telling sign. So we've talked about, you'll have the opportunity to go interval concerns that you've had, feeding and pooping conversations, and they'll review safe sleep as well at this point. And still, these days, the best way that is recommended, that is the safest for a baby to sleep, is on their back with no loose objects around them. Mm-hmm. And that's back to sleep is a nice coined term for marketing, but that's the safe sleep as well that reduces the risk of sudden infant death syndrome. So there will be a physical exam completed of your baby and all the different measurements. They'll measure the height, the weight, the head circumference, and it'll be put on percentiles that are compared across all of the averages of other children across
all of them.
I think it's the WHO. So it's across all the different children ever.
All of the fetuses ever. Your 2-month-old might still look like a fetus, but that's okay. Give it a couple more months. They'll eventually get cute. The term, what's the saying? Or no, the saying, a face only a mother can love, came from somewhere.
So
probably from a funny looking newborn, but it gets better. They'll grow into their features.
And once we have all those conversations about those topics, a bigger conversation about development is brought on. And the CDC doesn't offer any sort of developmental milestones for the first month, but they start at the second month. And we're practically just reading off of the website here, offering this information on our platform. But I will say that there are different categories of development that are tracked over time. And the idea behind these questions is that 75% of children, babies, should be able to do these things by 2 months. This is a recent change from when it used to be 50% of babies could do these things that we're going to talk about next. But that wasn't so informative and didn't leave much room or use in terms of making decisions about whether a baby should receive early intervention from any services or whether some things should be watched over time. So let's go over what these milestones could be. These will be questions that are asked of you at the doctor's office, and you'll have to speak for your baby since they're an infant and can't speak yet. So the first one we have that Nikki will review with us are the social and emotional milestones.
So a normal full-term baby, socially, they're now starting to, I don't know if I want to say recognizing faces, but they'll start to like see more clearly. They'll most likely be smiling at, like starting to smile at mom and dad. It'll be easier for mom and dad to kind of like calm them if they're crying.
So the next set of questions will be focused around language and communication.
Yeah, so language and communication. This is kind of the time when your baby will start making sounds other than crying. They're still going to cry, but there's this whole thing. You can look up the 5, I think it's 5, 1, 2, 3, 4, 5, the 5 different types of baby cries. Because there's one, it's if they make like a nah sound, it's for hunger. Every kind of like cry has like a certain sound in the beginning, and you can kind of like learn your baby, and then you'll learn kind of what they're asking for, which is kind of cool. I don't know if it has a name. I just tried to look it up. I don't know if there's an official name, but if you check the 5 types of baby cries, it'll like give you a whole thing. And there's a lot of like videos about it too. It's pretty cool because then when they talk about the different cry and then like show the baby crying, and like to hear it, you can actually hear it.
And do they sort of react to loud sounds as well at this point?
Yeah.
Which would be something. It's important that they do that so you can keep track of their hearing as well. There's a hearing test that happens in the hospital, but it's been 2 months. You should check in on it. And so then there are some cognitive milestones, things like learning, thinking, problem solving, which at this point, once again, 75% of babies do. 3/4 of babies are able to do this. So what sorts of things cognitively is a baby able to do at this point?
So cognitively, this is a time where babies are now, they're kind of starting to track you with their eyes, and they'll follow you around the room, and they'll kind of look at a toy. A lot of people will kind of use a high contrast toy specifically for babies, where there are also like phone cases that are like high contrast, so that when you're like holding your baby and then you're on your phone, like your baby can look at the high contrast thing and like they see it. But a lot of people will use, again, the high contrast toy specifically during tummy time because the baby's like, I don't know, like attracted to it, I guess. I don't really know what the right word is to use, but then they'll like follow it around so that the baby like lifts their head up, follows it. And it's easier for them to see, I guess.
To work on the neck strength.
Yeah.
Wow. And how much more?
Which kind of goes into
movement. Movement and physical activity are things that are also tracked at these visits.
We're doing your tummy time. You can hold up your head during tummer time. During tummy time. There's our intern. Ollie loves tummy time. So, and then tummy time timing. It doesn't look like there's like a hard and fast, this is how many minutes or this is how long your baby should have tummy time for. A lot of it will be how much your baby can tolerate it. But it looks like, like a couple minutes a day, a few times a day to maybe have like 30 minutes to an hour is sufficient. And if you have, any concerns or true question about that, or want some more specific guidance, you can talk to your pediatrician about it at their 2-month appointment.
Is there a specific goal of tummy time?
Yeah, so the main goal is it's kind of like a little mini workout for your baby, mainly focusing on their neck strength because that's a huge part of their physical development. And they got this big old head and these weak neck muscles, so they have to, they got to support it.
Huh. Okay, nice. So far we've reviewed social and emotional development, language and communication, cognitive development, as well as movement and physical development. And these tenets are what will be followed throughout the rest of the developmental milestones as we cover them for routine pediatric care.
And I guess also just to say your baby's milestones at 2 months are like drastically different from when they're a newborn. If that wasn't obvious, you know, because your newborn is just kind of a blob. And then now you're 2-month-old, you're smiling, we're doing tummy time.
I feel like these can be nerve-wracking. Like if you notice and you're like, oh no, like they haven't done that yet. I think it's still within the range of normal that your child may not be doing these things right at 2 months, but maybe next week they will be. And there are also things to do that you should ask your pediatricians about. Should this come up and present itself as an issue, or you can ask about how we'll be observing this in the plan. One thing I want to mention and highlight is that you should let your pediatrician know if there were any skills that the baby had that they once lost. And I think that's an important thing to keep in mind and to keep an eye out for when you go to these visits. So by listening to that section, you'll be more prepared so that you'll be able to have a more robust conversation with your pediatrician, and you can participate more instead of kind of being blindsided by these questions, because they often come quick, I'll say.
Alrighty. Now we're going to talk about another, probably like the other biggest part of every visit when you're a baby is getting your vaccines. So what vaccines are we giving at 2 months?
So this is when the bigger part of the vaccine schedule opens up. And so far, your baby perhaps has had hepatitis B when first born and the hepatitis B vaccine at the first visit, or it was saved for now, reasonably so. But there are several vaccines that are due today. Many of them are delivered in a combination vaccine to reduce the number of pokes. But before we get started, a word on vaccines is that they are extremely important and they are safe and effective, which has been studied over and over again and is very important that we say that loud and clear. They prevent serious, deadly, or disabling diseases that once existed and don't exist now.
Why don't they exist anymore?
Or have become very rare because of these vaccines. Vaccines themselves lead to herd immunity, which is a complicated epidemiological concept, but essentially means that because so many people are immune from a disease, a virus or an illness cannot be transferred from one person to another because there are just not enough people who can get sick from a virus or an illness like this. So that is herd immunity, and that is the core piece of why this vaccine schedule is so important, because these diseases that people don't hear about anymore don't exist for this reason. Great. Well, now we can get into the details. So you'll find different names and acronyms for these vaccines. The first one we'll talk about is DTaP, which stands for diphtheria, tetanus, and essentially whooping cough. It stands for acellular pertussis. We won't go into each of these diseases. Feel free to look them up and be scared on your own. But the DTaP vaccine is the first of 5 doses that are given routinely at pediatric visits. The second vaccine is Haemophilus influenza, which is abbreviated HIB. Can I get a HIB?
HIB.
And that is the first of 3 or 4 doses.
Sounds like from the Princess Diaries, Mia Thermopolis.
Mia Thermopolis.
It sounds like that.
Now we've got
doesn't it?
Wait, what movie?
Yeah,
Princess Diaries.
Princess Diaries.
Yeah. Well, coming of age movie. There were 2 or 3 of them.
I know there were 2, but there might be 3 that I don't know about.
I can only imagine how many people are listening to this right now, waving their hands, being like, keep going. Come on, I want to hear about HIB. Haemophilus influenza, not to be confused with Mia Thermopolis.
Princess of Genovia.
First of 3 or 4 doses. All of this is public data on the CDC website. The hepatitis B vaccine, perhaps around this time, your child will get the second of 3 doses. I will say that there is no cure to hepatitis B, but the best way is to prevent it. And so that's why we do this, because it is the number 1 viral cause of liver cancer that is preventable. The next vaccine is the pneumococcal vaccine, which is a vaccine that protects against pneumonia and other types of bacterial infections that people can suffer from. This is the first of 4 doses of this vaccine. And one that we literally don't hear about anymore because it has been eradicated is polio. And everyone's vaccinated for polio. It is the first of 4 vaccines. When it was first developed, this was a life-changing scientific development, and now is just a part of routine science. Everyone gets this, which is incredible. It is disabling, and it is a life-threatening illness that doesn't exist anymore because these vaccines exist. The last one is rotavirus, which is the first of 2 or 3 doses, which protects against a virus that causes profuse watery diarrhea, which can become dangerous or just simply exceedingly uncomfortable. And while I mentioned that's a lot of vaccines, many of them come in combinations at this point and also are safe and effective. One thing we're not going to dive into, but we wanted to comment on, is that there is an RSV, which stands for respiratory syncytial virus, an RSV immunization. It's specifically not a vaccine, but it is an immunization that has been found to be safe and effective at preventing serious illness and hospitalization in children. If you've ever heard of bronchiolitis and you've ever met a child.
If you have a baby, you've probably heard of RSV.
Yeah.
It's a thing. It's a big thing. And,
that I think is the number 1 cause of admission into a hospital.
It is, yeah.
So does every baby get this RSV immunization?
No, it's not given to every baby. One, which sounds like a cop-out, is that it's very, very expensive. And then there are certain qualifications that your baby needs to meet. Like one of them is their gestational age. And then it's a lot, like a certain diagnosis of like one of them is BPD. But then it's like you have to be X number of months when RSV season, which kind of coincides with like flu season rolls around. So there are a lot of different things that go into that. It's not just something that you can go to your pediatrician and ask for it.
Got it. So it's not commonplace yet. I think everyone's very excited about it for babies because of, if you've ever worked in a hospital on RSV season, I'll say it like this. That was the hardest 2 weeks of residency that I had, was in a pediatric hospital in RSV season. And I would welcome a commonplace RSV vaccine with open arms to reduce the burden.
It is scary, and people talk about it a lot because it is so scary. And we've both watched babies stop breathing when they've had RSV. So,
So while that's not commonplace, it could be offered and could be a discussion that you have with your pediatrician, whereas these other vaccines are recommended with very, very few circumstances where someone shouldn't get them. But I encourage you to ask your doctor to review those because they're very safe, effective, and we do it for a reason. Okay. So altogether, we covered a brief talk on the first month visit and what could be different or done about that as a part of the schedule. And we talked a lot in detail about what happens at the second month visit, including common conversations had regarding interval concerns, feeding and pooping, safe sleep. We covered developmental questions and had a nice conversation about that, and the function and purpose of vaccines. So we hope this was helpful, and we really appreciate that you came back and listened again. And whether you're listening for yourself, a friend, loved one, or
a neighbor,
we'd love you to tell someone about what we're doing here, or just simply tune in next time, because we're really excited about all of our distant listeners and local ones who we know and love. So make sure you subscribe, rate, and review wherever you listen to your podcasts. Follow our Instagram, Your Checkup Podcast, where we put infographics and our artwork for our posts. And most importantly, stay healthy, my friends. I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. we explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.